Welcome to Sleep, Sex, and Senility, where we unpack the surprising connection between how you sleep, how you feel, and how your brain and body function over time.
Before we begin, a quick note. This podcast is for educational purposes only and does not provide medical advice. Please consult your own healthcare provider for recommendations specific to you.
Welcome, everybody, to our next episode of Sleep, Sex, and Senility. We are so glad that you've chosen to take some of your valuable time to spend with us today. I'm Dr. Ellie Campbell. I'm a double board certified family physician and passionate about oral health connections to systemic health. And I'm here today with my dear friend and colleague.
I'm Dr. Kathleen Carson, and I am a oral systemic dentist with a heavy focus in airway.
And so today we thought we would talk with you about cognition, about brain health, because I think it is underappreciated in both the medical community and the dental community about how much connection there truly has been identified between what happens in the mouth and what happens in the brain. So we kind of want to narrow down to maybe 5 topics today to share with you ways that you can help to understand some of the important connections between oral health and brain health. So I think the mouth-brain axis is real, and chronic oral inflammation is really not confined to the mouth. We call it oral inflammation, but if it's in the mouth, it's pretty much everywhere. It contributes to this systemic inflammation, and God gave us a very stout separation between our brain and the rest of the body. And there's a thick membrane there, and it is called the blood-brain barrier. And it means that bacteria that might be in the bloodstream have a very hard time to get into the brain. But that also means nutrients sometimes have a hard time to get to the brain. It's good when it's a toxin or a toxicant we don't want to get in the brain. But there's been some ways that our body has lost that blood-brain integrity, and inflammation is one of the things that starts to degrade that tough barrier that prevents inflammatory markers coming from the body to get into the brain. So when there's oral inflammation, it begins to activate white blood cells in our brain. Neurons in our brain are called microglial cells, and these become dysfunctional. And when they do, they start to drive cognitive decline, and we start to lose our words and lose our memory and lose our problem solving ability as a marker of neurodegeneration. So what happens in the mouth doesn't stay in the mouth and can spread to the brain when the blood-brain barrier is disrupted.
Nobody ever told the bacteria they were supposed to stay in your mouth. So
Right.
it turns out, the inflammation doesn't stay there. It's a single cell barrier, and it crosses right over into the rest of your body. And we know that we have a smoking gun in the gum tissue, right? We've got P. gingivalis, and that
Yeah,
can
so
head
we have
straight
these
to the
mouth
brain.
bacteria. We're supposed to have bacteria in our mouth. Anybody who tells you that you're supposed to use mouthwash and annihilate all the bacteria that live there is telling you a fairy tale. That is not supposed to happen. We need to have bacteria in our mouth. They're supposed to be there. But when there's a shift in the microbiome and unfriendly pathogenic bacteria begin to grow, that can become a problem. That can become a real problem. And there's a set of these bacteria that behave a certain way, and they've been labeled as red complex bacteria. And one of the most aggressive of them has a name called Porphyromonas gingivalis, but we call him PG for short. And he's a really bad actor. Dr. Carson, can you tell us some of the bad things that PG does?
Well, first of all, it's going to cause inflammation in your gum tissue, but that can spread to the rest of your body because it turns out that PG, one of the ringleader of the red complex bacteria, if you will. It's what we would call a keystone pathogen, which means he's the key player. He's the ringleader, and he's allowing other bad bacteria to interact and become basically a complex together. And we've found PG in the brains of patients with Alzheimer's disease. And that PG also makes these toxic enzymes. Gingipains is what they're called, and they promote amyloid beta accumulation and tau protein dysfunction. And, that's the hallmark of issues that we see with Alzheimer's patients and Alzheimer's disease. And this is a direct pathogen that comes straight from the mouth.
Yeah, so I call gingipanes melting enzymes because
Mm.
in your mouth, they start to melt your gum tissue, right? And so it makes those gums very fragile and bleedy. So when you brush or floss your teeth, you see pink in the sink. PG is often at the core for the reason why that's happening. But that bloody mess that's in your mouth can also be caused in your brain by this same melting enzyme when
Mhm.
Porphyromonas gingivalis gets out of your mouth and up into your brain. How does it do that? Well, there's several mechanisms that have been identified. One is it hitches a ride on your blood cells and actually goes through your bloodstream up through that blood-brain barrier, especially if it's inflamed, and it travels directly into your brain. A second way is through the lymphatic tissue. We know that we have lymph vessels very close. We see those lymph nodes right underneath our chin. We know we have lymph tissue there. And we believe that these bacteria, once they get into your lymph system, can travel backwards up and down through the lymph system and get into your brain that way. We
Mhm.
found that these bacteria can climb up your nerves. You have a trigeminal nerve that goes through into your face and up into your brain. And those bacteria literally climb like a little ladder right up that
Mhm.
trigeminal nerve into your brain. So they're very tricky and they're very tenacious and they don't like to just hang out in the mouth. Once they get into the brain, they can cause this melting phenomenon, which your brain tries to heal by making these collections of proteins over the top of these wounds. And we identify these on scans as tau proteins and beta amyloid. And everybody's like, oh, that's the cause of Alzheimer's. Well, really, we think those are the healing mechanisms of your body trying to protect itself from these infections. So we don't want Porphyromonas gingivalis in our mouth, and we really, really don't want it in our brain because most of us are more afraid of losing our minds than losing our lives. So we want to protect our brain. And I believe that all of us should know if we have PG in our mouth or not. How do
Mhm.
I know that, Dr. Carson? If I floss and I see pink, do I have PG? Is it always the case?
No, that's not always the case. You can't assess what you don't test. So there are salivary diagnostic tests out there, super easy. Spit basically in a little tube. Your dentist can send it in and get a full report as to the microbial balance in your mouth. Because as Dr. Campbell said, we need the bacteria. We need the good bacteria. We want a healthy garden. But when our garden becomes unhealthy and the bad guys like P. gingivalis and the other red complex bacteria take over, you don't know that is the case necessarily without testing for it. And, I have plenty of patients that come in and they say, they're doing all the hard work to try to eradicate the bacteria in their mouth, using antimicrobials and antiseptics. And the thing is these bad guys are actually resistant to a lot of those techniques. So by doing that, you're just creating worse of an environment. So some of these patients that come in and have what they think is a beautifully sterile mouth, they're actually overrun by PG and the other red complex bacteria, and they have no way to know that because they think they're doing the right thing. So definitely be aware. We don't want to eradicate all the bugs. We want to garden appropriately and till for the healthy soil.
Yeah. So you're saying that if I have a family history of Alzheimer's disease and I want to protect myself by not having PG in my mouth, all I have to do is spit in a test tube and I can discover if I have that bacteria or not. It's that
Yeah, pretty
easy.
much. It's as easy as that. And I don't know why we don't do it more. We should be doing this pretty much for every patient. It's too simple, too easy, and too accessible.
So if I'm a patient, what should I ask my dentist for? That spit test for PG? Are they going to know what I'm talking about?
If they don't, you should probably maybe find another dentist, but educate them on what you're talking about. But yes, you can go ask your dentist for a salivary test to see what type of bacteria you might have in your mouth. I think that would be the best way to phrase it. And if they go, you don't really need that, maybe send them to our podcast.
Yeah. And so I'm a primary care family physician. I'm not a dentist at all, but I
Hmm.
offer this salivary testing in my office because I believe it's such an important part of primary prevention that I included it in my annual exam for my my patients when they come for their once a
Oh,
year oil change and tune up checkup appointment. So you don't have to be a dentist necessarily to get this
mhm.
test. You can get this from your primary care provider if they're enlightened and educated about the ways that your mouth and brain are connected and they're interested in offering this test. By the way, PG can do a lot more than just get in your brain. It can get into your heart, it can get into
Mhm.
your coronary arteries, it can get into your carotid arteries, it can get into your pancreas, it can get
Yep.
into your gut. There's been associations with PG and cancer and heart attacks and strokes and diabetes and all manner of systemic complications. So we really do want to know if we have PG. Porphyromonas gingivalis is associated with amyloid beta accumulation, tau protein dysfunction, direct neuronal injury. And as a result, we know that this is a causal contributor. It's not just an innocent bystander found in your mouth, but it's found everywhere. There's
Mhm.
toxins that can be in our mouth as well.
Yes,
One
there
of
are.
those toxins that can leave our mouth and get into our brain is called mercury. Why would I have mercury in my mouth?
Well, as many of you probably know, amalgam silver fillings were the standard of care for many, many years. It was kind of all we only had. And a lot of people ended up getting silver fillings put in their mouth. And it turns out that about 50% of silver fillings is actually composed of mercury.
Oh, so silver filling is not really silver. It's really more
It's
mercury.
about 50% elemental mercury by weight, if you can believe it. And it's in hundreds of millions of mouths. It's been placed for over 150 years. Can you believe that?
And mercury is a poison, isn't it? Like if I put it in my fish pond, I'm not allowed to eat my fish,
Yeah, and if you drop a thermometer in a school, they have to evacuate the whole place.
but it's in my mouth or it was in my mouth.
It is. I mean, the idea behind it was that it became a stable product once placed and set. And the problem is though that we're constantly using our mouths. This isn't just something that's sitting and stable in isolation.
Like my earlobe. If it was in my earlobe and it might not cause so much trouble, but I
Right.
chew every day and
Not as
swallow
much, but
and
yeah, in your mouth, you're chewing your food, you're grinding your teeth. We've got temperature fluctuations in our mouth. We've got acidic foods, and this will vaporize the mercury over time. And there's a lot of evidence out there that actually that supports this now in peer-reviewed journals and articles. And we know that you can inhale the mercury and it gets absorbed through your lungs. It's lipid soluble. It crosses that blood-brain barrier that Dr. Campbell was just talking about, and even the placental barrier. So, it can get into the brains, and we're talking about cognitive health today. And we know that elemental mercury is a neurotoxin and a very potent one, right?
yeah, it's very toxic. Actually, so our nerves have a little sheath around them called a
Mhm,
myelin sheath. It like
mhm,
acts like insulation and it's built by little building blocks. And
mhm.
mercury actually uncouples and destroys those building blocks. It rusts them away. And
Wow.
so when that happens, the tails of the nerves begin to shrivel up, and you can detect them as these neurofibrillary tangles on a pathology specimen as one of the hallmarks of Alzheimer's dementia. And so, in some cases, probably a contributor to that dementia syndrome was the
Mhm.
presence of the neurotoxin mercury, which was found in the patient's amalgams in their teeth. And
No.
so that doesn't mean every patient needs to rush out tomorrow and go get their mercury
Mhm,
amalgams removed tomorrow, but it does deserve a conversation and an assessment about your level of oxidative stress,
mhm,
nutrition, inflammation, diet, eating habits, and how those amalgams might be. Some amalgams, properly placed, are good for decades and don't
mhm.
degrade and don't cause a lot of mercury vapor. Others, however, are degrading earlier and probably do need to be removed and replaced with safer alternatives, or in the worst case scenario, have the tooth removed in its entirety, which is never our first choice, but it's an option on the table in some cases. So, keeping the mercury out of our mouth to prevent it from getting in our brain is a really good dementia prevention strategy.
Well, and you don't want to just, especially if you have concerns about being predisposed to Alzheimer's or cognitive decline or really any health issues, if you're going to get your mercury fillings removed, you should go to a dentist that's trained to remove them safely. It's not a difficult thing to do, but it does require a little bit of extra training.
And
Because
equipment, training and equipment. The
and equipment,
patient
yes,
needs to
and
be
equipment. You were correct.
specially draped. The dentist should be specially draped. There should be special vacuums to suck out the mercury vapor from your mouth as they're drilling that filling out. Because as Dr. Carson previously mentioned, it's the mercury vapor that's some of the most toxic part of the mercury, and that's created at the time of the filling removal. So we
Mhm,
want to be sure that we are protecting not only ourselves as patients, but our dental professional providers who are in that room with us from this mercury vapor, because we don't want them getting dementia because they've been exposed to too much mercury vapor. So
right.
getting a dentist who's well trained in amalgam removal and asking pertinent questions. What training do
Mhm,
you have in removing mercury from my mouth? How will that mercury be disposed of? Where will
mhm,
what protection will I have? Will I have to wear a mask? Will I have to wear oxygen? Will I have to be in a special gown? What are you going to do with the chunks of mercury that come out
mhm,
of my tooth?
mhm.
What's going to happen to that, and how am I going to be protected against that as it's being removed? So
Yeah.
those are easy questions to ask and a conversation that you should have before you sign on the dotted line to have that filling removed.
Mhm. Yeah. Well, and we know what a potent neurotoxin mercury is. And so if you're somebody that has, let's say, a number of older fillings there, and then maybe you go get that saliva test we were just talking about, and you have elevated red complex bacteria or P. gingivalis, now you've got the double whammy. Those are both acting as, inflammatory contributors and neurotoxins. So you're going to want to be extra careful, but make sure you get things addressed.
Right. Because again, it's the integrity of that blood brain barrier that matters so much. And
Mhm,
so we probably would not want you to have your mercury filling removed right after you had a concussion, right?
mhm.
Because you have disturbed your blood brain barrier with that
Yep.
trauma event. So let's let you heal from that. Let's not do this as an emergency, but do it at an appropriate time, not right after you had the flu or COVID when
Right.
your cells and tissues are inflamed. But we talked about how Porphyromonas gingivalis is one of the bad actors in that keystone bacteria, but there's other bacteria in your mouth that are red complex and gram negative as well. And they make this little piece of membrane called lipopolysaccharide. And these little pockets of crap will leave these gram negative bacteria and trigger inflammation and vascular permeability. That means many of us have heard of the story of a leaky gut before, where we know that the integrity of our intestines has been impaired, the cells are swollen, and now food particles can be presented to our immune system as if they're foreign invaders. We can get a leaky endothelium as well. Our cell lining of our blood vessels becomes swollen, inflamed, and leaky. And now all these inflammatory cytokines and lipopolysaccharides and TNF alpha and all of these inflammation markers can now make swelling within the tissues. If that
Mhm,
happens in your brain, that's really bad. This inflammatory mediator and even microbes then can pass
mhm,
through these leaky membranes, accessing the brain. And if there's mercury present at the same time as lipopolysaccharide, low nitric oxide levels, all these things contribute. And it's really important to take a big zoom out picture of the patient's
mhm,
overall health history to identify the most appropriate time to start
mhm,
treatment and what treatment should be done first. Should we remove the bacteria first? Should we remove the mercury first? Should we
mhm.
talk about sleep hygiene first? There's many things that will affect our brain health, and we want to go for the most important thing first. And that's really decided on a case by case basis between you and your dental professional.
Well, and did you know, Ellie, that the ApoE genotype, that's the genetic marker, right, to see if you're more predisposed for Alzheimer's risk. ApoE4 meaning that you're at higher Alzheimer's risk. Did you know that it also means that you clear mercury less effectively?
Yeah, I
Yeah.
did know that. There's, apolipoproteins are carrier molecules. And so when they're misshapen, they can be a good way or a bad way. And if they're in this bad way, they do a lot of things inefficiently. One is clear mercury and other toxins, and the other is clear proteins from your bloodstream and your arteries, leading to an accelerated buildup of plaque.
Yeah.
So, and that plaque, we talk about plaque on our teeth,
Mhm.
and we have to go see our hygienist and get that plaque cleared off. We don't have anybody that can clear plaque out of our brain. So the
Yeah.
only way that we can do that is not get it in the first place. And
Yeah.
if you have ApoE4, you really need to be especially careful about your oral health,
Mhm.
because it is more likely to predispose you to
Mhm.
earlier complications, literally shorten your lifestyle. But the good news is we have treatments now, and we have ways to identify that you're at risk. And we
Mhm.
have genetic markers that we can test
Mhm.
for your diet, for your supplements, for your medications, to determine what best practices for your individual case should be. That's a really exciting time to be in medicine, because we can personalize and make precision decisions for you based on where you are now and where you
Mhm.
want to be in the future.
And, you know, I think it's interesting that the mercury amalgam conversation is still out there because we do have all the data around how potent and bad it is for us. And it was 2020, which was not yesterday. I mean, we're talking 6 years ago that the FDA came out and said that we can't put amalgam in pregnant women, children, or people with neurological diseases.
Right.
Um, who's left? But it's not new news, but it is unfortunately still somewhat of a controversial conversation.
Yeah. And unfortunately, the reason why it's often done is twofold. Number one is it's a little bit cheaper to
Yep.
put a silver filling in than it is to use one of our white tooth colored composite fillings. So when it's cheaper and every penny matters,
Mhm.
often the decision is made that's a financial one rather than a health decision. The
Mhm.
second thing is that if the clinic is not yet set up to do composite fillings the new modern way, even though it's not been that modern, but if they're
Mhm.
not set up in this way, they're they're following their old habits, and they're doing the same that they've always done. And unfortunately, many of those clinics are in rural and underserved areas where social determinants of health are driving healthcare decisions based on finances alone and
Mhm.
not on the long term health of the patient. So we fear that many of our most stressed people, people of color, people of lower socioeconomic status, people of lower educational status, these are the ones who are getting our amalgam fillings.
Yeah.
And that is a social injustice that should be brought attention to, and every effort made to educate the parents, the pregnant moms, everybody, that this is not an acceptable protocol to use silver fillings any longer. We know the dangers are too great. Our brains are too precious of a commodity that we need to preserve and not put a known neurotoxin in our mouth on purpose.
Mhm. Yeah. Well, and we talked about to change the topic just a little bit. We had talked about bacterial balance and the correct healthy garden that you want to have in your mouth. One of the number one things that I see outside of, poor oral hygiene or cleaning issues or outright periodontal disease, one of the biggest things I see in my practice for somebody that might have an imbalance in that microbiome is people that mouth breathe,
Mm,
right? And so that's going to lead to a microbial imbalance, but it also, which will lead to cognitive decline, but it also means there could be another huge missed element leading to Alzheimer's and cognition issues around potential poor sleep breathing
right.
concerns, right? That's
Yeah.
a
So
third
sleep
huge
disordered
contributor.
breathing, anytime your oxygen level drops while you're
Hmm.
sleeping at night, your brain is getting starved.
Right.
And so we don't want to choke off your oxygen to your brain while you sleep. And mouth breathers are often mouth breathing because they have sleep apnea. And if they don't breathe with their mouth open, they're not going to breathe at all
Hmm.
because they've forgotten how to use their noses. It's called nasal disuse atrophy. Their noses are clogged, or they're just out of habit of using their tongue in the proper position. And they need to have some physical therapy training to get their mouth in the proper position and learn how to pull their jaw closed and keep their mouths closed at night. Because when you mouth breathe, you dry your mouth out.
Hmm.
That can lead to morning bad breath, but it can also lead to a very acidic environment that favors the growth of the unfriendly bacteria. We need to water our garden to keep the healthy vegetable plants growing. If we don't water our garden, probably weeds will grow and our favorite plants will not. So
Mhm.
those bad bacteria thrive in that acidic environment of a mouth breather.
So from a dental perspective, we see that in the dry mouth. We see it in the microbial imbalance. We see that in more decay, more apt to have decay. So when I'm coming across this and my patients are just watching them mouth breathing, I'll ask them, has anybody ever talked to you about how you breathe? And it's not just about during the day, but it's at night. And you may have a sleep breathing concern, which can lead to potential upper airway resistance or sleep apnea. And a major oral systemic link there is Alzheimer's disease or cognitive decline. And the cause can be multiple factors, like you mentioned, nasal disuse or allergies or congestion, or it can be a narrow structure, which is something the dental team is trained to look for. Maybe they structurally aren't developed enough to be breathing in healthy ways day and night.
Right. Or like
We can fix
me,
that.
you may have had 4 teeth pulled as a teenager.
Hmm.
Try to make room for your small mouth so the
Hmm.
orthodontist could straighten your teeth. And then as an adult, with a little bit of weight gain and some menopausal tissue laxity, all of a sudden developing sleep apnea as an older adult, in part because of the small mouth that I was granted by my orthodonture work way back decades
Hmm.
ago. So that can be corrected, however, right? So
Hmm.
there's appliances that I could wear that increased the size of my jaw, went to myofunctional therapy, learned how to do exercises for proper positioning of my tongue, learned how to tape my lips closed at night
Hmm.
while I sleep. And now I don't mouth breathe anymore and I don't have sleep apnea like I used to, and I don't have to wear a CPAP. So that was life changing for me and hopefully preserved my brain and gave me a bunch more years of a healthy, strong brain because I'm not dropping my oxygen at night like I used to.
Well, and it's not just dropping the oxygen at the night too, but we know that the disruption in your sleep cycles, you're not getting your glymphatic clearance that you need, right, for brain health
Right. So, yeah,
also.
so
So
that's
it's
something interesting too.
multifactorial.
Yeah, lymphatics. So, this is so fascinating to me. When I was in medical school 40 years ago, we did not know that the brain had a lymph system to clean itself out.
Right.
We never were taught that in anatomy class. Somehow we did all those brain dissections and we missed this entire anatomical structure called the glymphatic system. And it is the way that your brain takes trash out from your metabolic functions
Mhm.
every night while you sleep. And if your glymphatic system is sluggish because you don't get into deep delta wave sleep when you're sleeping at night, then the trash remains. And what do you think trash is going to do to your cognition if it hasn't been cleared out by your body's natural cleansing mechanism? So,
Mhm.
so important to have deep restorative sleep. So it's not just the number of hours, but the quality of the sleep as well as
Yep.
adequate oxygen. These parameters all matter, and we can assess them by doing a sleep test
Mhm.
at home in your own bed to determine if you have sleep disordered breathing, upper airway resistance syndrome, sleep apnea. Simple tests, not super expensive for us to be able to identify if you're one of those people that has an oral contributor to dementia, because
Okay.
unlike genetics, oral disease is relatively easy detectable,
Yep.
measurable, and treatable. We
Yep.
can address your periodontal disease, whether you have bleeding on probing, whatever your hygienist says in terms of your gum health. We can look at your pathogen burden. We can look at your heavy metal status. We can look at your systemic inflammatory load. We can look at your vascular health. All of these things put together can give us clues as to your risk for premature cognitive
Mhm.
decline. So this
Mhm.
now is going to reframe dentistry for us as a frontline tool to preserve brain health. And I think that's a really exciting time to be in the oral systemic field because reaching across the aisle, we now have the ability to change the trajectory of your future brain health.
Yeah. Yeah. And another topic that we talk sometimes quite a bit about too when we start talking about that microbial imbalance and the healthy garden in your mouth. Another thing we dentists can look for is nitric oxide production. And that also plays a role in all of this because, the Alzheimer's risk, there's the vascular dementia format of that.
Mhm.
And nitric oxide, as Dr. Campbell can tell us all about, plays a big role in that. And we know ApoE4 carriers also demonstrate endothelial dysfunction more. So as a dentist, we can, and a medical provider too, but as dentists, we're in the mouth all the time. We can use little test strips to see if the bacteria on the back of the tongue are the ones that are able to do the job. We can do the spit test, check for a balance, but there's a key role that we mouth doctors have in helping to evaluate if our patients are able to properly produce that nitric oxide. And so it's the mouth bacteria and it's nasal breathing. But doesn't that play a pretty big role too?
Absolutely. I think, nitric oxide is really interesting. It's a gas. It's a gaseous signaling molecule. It was one of the first in human chemistry that was ever discovered. That's a gas that makes cellular communication and affects so many pathways. Not only does it affect blood vessel dilation, which is kind of where they first discovered it, but it affects the immune system. It affects hormonal signaling. It affects neurotransmission. It affects um, kidney function. So many places nitric oxide has a role. So I call it the miracle mouth molecule because while it's primarily made in the nose while you're breathing through your nose, the substrate is made in your mouth. And
Mhm.
if you don't have enough bacteria, healthy bacteria in your mouth to convert nitrite that you eat into nitrate, then you can't make nitric oxide. So let's
Mhm.
talk about diet. Holy cow. If you are not getting enough fruits and vegetables, especially for the nitric oxide pathway, the leafy greens, arugula, and spinach, or the root of the beet, the red part of the beet, these are really strong nitrate
Mhm.
foods and they give your body the precursor that it needs. So first you got to be getting enough of that. Then you have to have healthy mouth bacteria. Then you got to be breathing through your
Right.
nose in order to make nitric oxide. So there's very many steps that can be messed up along the way. And if you're using mouthwash to annihilate those bad breath bacteria, we're probably going to annihilate those nitric oxide producing bacteria. And we know that studies show you can raise your blood pressure just by using these
Mhm.
mouthwashes. So, and part of the mechanism for how that happens is because we cleared away the friendly bacteria that are supposed to be living there, in addition to the bad bacteria that were making your stinky breath. So, we don't
Right.
want to be doing that. We don't want to be messing with that. You always want to talk with your dentist about what oral products should be used to create a healthier mouth environment.
Yeah, and so, Dr. Campbell, you're helping a lot of patients with all of these medical issues that we're talking about. And so the things that my colleagues can help you with are, I mean, we just covered a good chunk of them. We covered bacteria, microbiome balance, testing, doing a salivary test, looking for the red pathogens, the P. gingivalis. We talked about evaluating old materials, whether or not the mercury fillings should be removed, and if so, how, and when, safely and at the right time. We
Right.
talked about looking for nitric oxide producing bacterias. We talked about evaluating mouth breathing and sleep apnea and maybe appliance use and craniofacial development. I mean, these are not insignificant things, and we can really contribute to how much you can help your patients. That's pretty cool.
It's really cool. And, I'm so proud that here in my practice now, I've had over 10-year track record of no heart attacks or strokes in any patient who follows our program. And in my opinion, the number one hidden risk factor to the number one killer in our country is poor oral health. And so without the assistance of my dental professionals, I was never able to achieve a zero track record.
Mhm.
And now that I am aware and I have leading indicators in blood, urine, and saliva, tests that I can do, including salivary diagnostics, I have tools and ability to say to my patients, oh my goodness, I see a pattern here that suggests that you have a dental problem.
Yeah.
Please go see one of these very enlightened dentists in my community so that we can eradicate your red complex bacteria, check you for a CBCT to make sure you don't have an endodontic tooth root infection that's contributing to lipopolysaccharide that's driving your blood pressure, that's causing your inflammation to
Yeah.
go up, that's making your LPPLA2 elevated, all these things that we now know, dental connections. And I'm so grateful for the experience and education of my dental professional friends who taught me these connections because now I feel like we've kind of cracked the code on how to take cardiovascular disease off the number one slot in our country. And without the help of dentists, we can't achieve that. So that's a good
Right.
place, I think, for us to end this episode and say thank you, everyone, for listening, for your time and attention. We're so grateful. If you like what you heard and you want to hear more, you want links to anything that we talked about, go to sleepsexandsenility.com. And past episodes will be on there. We'll be announcing future events on that webpage as well. And again, grateful for your time, energy, and attention. Thank you for listening to Sleep, Sex, and Senility. I'm Dr. Ellie Campbell.
And I'm Dr. Kathleen Carson. We're so glad you were with us.
Nanoverse Media, making the world smaller.